Assalamu alaikum. I am Dr. Afshan Khattak from the SPIRE initiative, and I'm going to go over some basic concepts related to medical research with you today. This is the first of a series of 4 sessions on basics of medical research. And those familiar with my work know these workshops as Medical Research 101. This is basically for people who are interested in doing medical research but who do not have access to well referenced and authentic sources that can teach them how to start doing medical research. So I've divided it in 4 sessions. Today, I'm going to go over bare basics and give you some very, very basic concepts that you need if you are interested in becoming a medical researcher. I may be popping in and out of screens because I'll be screen sharing my presentation with you. Don't get confused. I'm as new to this process as you are. I will welcome your questions at the end. And since the lecture will also be uploaded to my YouTube channel, which is Dr. Afsha, you can go visit the channel, share the link with those who are interested in doing it, and subscribe to the channel if you want to stay informed about the new sessions that I will be conducting on the subject. So let me just go over to screen sharing and show you the presentation for today. Here we go. I am screen sharing Medical Research 101. And here we go. All right. All right. So for my introduction, I have been teaching medical research since 2005. So that's close to 18 years. And even before that, when I was a fellow, I did 1 year of bench research. So I am familiar with a lot of concepts. And my area of specialty is how to teach innovation and research to young aspirants of this subject, both at undergraduate and postgraduate levels. So, first of all, and I really, really love this quote, it is by the Prophet, peace be upon him, that actions basically are because of intentions, and each man will have but that which he intended. So, make sure if you are interested in doing research, make sure that you make your intentions very clear. That you just, you tell everybody around you that I'm interested in doing research. This is not a secret. It is not supposed to be kept as a secret. And in this first step, when you declare that you want to do research, you're actually flipping the negative label that is keeping you stuck. And the negative label is that medical research is very difficult, or that we don't have time to do research, or that I need to do a certain something. I need to attend a course. I need to get a certificate so that I can do medical research. And also, that internal argument that, I don't know how to do research. I never learned it in medical school. So I'm not sure how to do it. You have to let go of this negative internal dialogue by saying that I want to do research. I want to be a researcher. Then a very important part of your intention or niya is to schedule it. If you have a fixed time every day, and out of the 24 hours of a day, all you need, believe me, is 1 hour. If you take that 1 hour to study research, to increase your knowledge, to attend sessions like this, like the one that I'm giving, or to read about other researches that come out in medical journals, just 1 hour every day. Schedule it, follow it religiously, and you will see, at the end of 1 month, you will have done at least 20 to 22 hours of reading and action about research. In 1 year, you will have maybe 300 hours of that. That is the time that a credit hour, so many credit hours will come out of that 1 hour per day. So you schedule your time towards research. And then when you follow your schedule religiously, when you are helpful, when you are helping others, celebrate, and just give yourself a pat on the back and say, yes, this is, I've done it. I decided to do something, I intended to do something, and I did it. Also, um, do it consistently. The purification that is needed for success, what I have in front of you is a verse from the Holy Quran that, zakah means to purify, to clean. So let go of the impurities. Let go of the negative thoughts. Let go of the time wasters that are stopping you. For the good deed that you want to do, make sure that you take as much as you can do of good deeds. And the best deeds are the ones that are done consistently. So do little, but do consistently. That is very important. Okay. Now, the only question that I have for you today, because this was an interactive session, but I'm giving it now, I'm just recording it for you. So, the one question that you need to ask yourself, why you wish to do research? What is it that has brought you to research? Maybe it's a promotion at the job. Maybe it's your wish to get published. Maybe it's part of a project. Maybe it's a part of your a degree or a certificate course that you are doing. So you should know very clearly why you are doing research. And let me tell you that if you are doing research and if you are giving time to something, then you have to be sure that you are doing your best, that you're not wasting time. That is extremely important, that you know why you want to do research, because that is the basic motivation and that is the basic drive behind doing research. Now, the reason medical researchers do research, they have one common reason. The sub reasons may be many, like I explained for you. But one common reason that all researchers have for doing research is to add to the body of scientific knowledge. Just remember that. In order to add to the existing body of scientific knowledge, everybody who is involved in research is doing research for that reason. And in our world, like I told you, we are at the brink of the ultimate one world vision. The entire world is networked, and it is not, I will not be known as me, but I will be known through what I left and what I shared and what I was able to change or improve in my lifetime. So it is not just me, as an individual. If I want to leave a legacy as a scientist, as a medical professional, as an educated mind of my time, I have to do research and I have to provide data. If I'm doing a lot of work and not providing any data, I will not be known, I will not be recognized, nobody will know what I did after I die. So, this, leaving that data and leaving that evidence in the world of science, in the world of technology, is something that the entire movement of research is based on. The objectives of this session, basically, as I told you, there are 4 sessions. The objectives are to develop a clearly demarcated territory for future research projects. So, through this workshop, I will help you demarcate a clear cut area, a clear cut landmark for you and for your interest as to where you will do research, where you will succeed in doing research. Then establish your own research question. Most of us may know, we want to do research. Yes, we want to do research. We may be able to give the time 1 hour per day. Yes, we are able to give the time. As professionals, we can make time and we can try our best to give, maybe half an hour, maybe 1 hour for research. Also, as professionals, most of us will know what is the topic or the area where we want to do research. We have our own interests. Some people are interested in outcomes, some people are interested in pathophysiology, some people are interested in treatments. We know, roughly we know what areas we are interested to do research. What we don't know is what is the difference between a topic and a research question. These are two entirely different things. And the starting point of a research is not a research topic. The starting point of a scientific research is a scientifically written research question. So I will help you develop that question through this series of sessions, and through the workshops that I give. I help the participants come up with a research question that forms the foundation of the entire research project. Then select the most appropriate research design to answer that research question. Once the question is developed, it becomes very clear what kind of a research design is required to answer that question. And once we select the design, our research is going to be useful to the rest of the world if it gets published. If we are able to provide evidence through our research, if we are able to provide data from our research that helps further research, that helps further innovation, that helps further development. So basically, once we have decided on a design, we should be able to do a full background search and provide a justification as well as the introduction of our research topic. Then we finalize a list of references for the research project. Now, the 4 sessions that I'm giving are going to be basically with these objectives. I'll try to cover one objective per session, maybe one and a half objectives, because I have 5 objectives and 4 sessions. But this is basically what the entire series is about. And these are the areas that I cover with the participants in my workshops, if and when I'm giving a workshop. Okay. Now, develop a clearly demarcated territory, a patient centered. For example, if I'm interested in patient centered research projects, which most of us are, there are so many territories. There are so many big areas that we can address as researchers. There are CAP surveys, knowledge, attitude, practice surveys. There are audits. Some people study diseases. Some people study diagnostic modalities. Some people study treatment modalities. Of course, there are subjects like palliation when treatment is not possible. Then there are, counseling skills, communication skills. There are questions related to ethics. uh, Patient satisfaction is a very big area. And of course, then sharing the results of different activities that are part of the work done in a healthcare setting, in a hospital, in a clinic, in community. So all these areas, and for all different areas of research, we need to be mindful about logistic issues. How easy it is to do this study, how can it be done in the minimum cost possible? Financial restraints. Then there are ethical restraints. Can we approach patients with these questions? And how will they receive these questions? And how the patient data is going to be protected? And of course, then there are administrative constraints which are genuine, and each healthcare facility or each healthcare setup has its own policies, has its own procedures, has its own limits on what kind of research can be conducted in that setting. Now, as I said, that this is the first lecture of the series, and I want to just directly go into how to establish your own research question. All of us maybe have a topic. For example, I think of I'm a pediatrician, so I think and I say fever, pediatric fever, or fever in a child. These words that are written in front of you are part of the epidemiologic inquiry. What, who, why, where, how, and when. And they can be applied to any topic in order to begin a research question. Remember, a research topic is a phrase, is a set of words, but a research question has a question mark at the end. That is what makes it a research question. And these are the phrases that are used in epidemiology, which is the science of study of disease and disease progression and epidemics. Uh, these are the phrases that are used to frame scientific questions for research. So as you can see here, I'm showing you, how is health related outcome distributed in terms of the place, person, and time? A descriptive epidemiologic question. Then there is hypothesis generation or theory, making theories. What hypothesis may explain why some people have the outcome and some people don't? Are there any possible theories? This is a disease that only affects old people. This is a theory. Then this hypothesis or theory is tested in the population, and that is hypothesis generation research. Then is analytical epidemiology. Is there an association between exposure to X and the outcome Y? So, if we say that people who smoke are more likely to have lung cancer, we are claiming an association. And whether that association really exists in the population or not is subject to research, which is analytical epidemiology. Then is causal judgment, to actually say that such and such thing has caused this disease. You know, oral contraceptives are related to is one thing, but to say that oral contraceptive cause strokes in women is a completely different situation, a completely different statement. And this is a causal judgment. Then research can be used for individual and societal decision making. What should be done to prevent or control the outcome? So this does not involve just one doctor, one patient, one hospital. We are asking that at the level of population, what needs to be done to prevent or control an outcome? And then evaluation of strategy, which means that, the steps that we took, did they really work? Did the prevention or control strategy work? Whatever steps we took to prevent an outcome, did they really work at the level of the population? So these are examples. This is something to get your mind thinking about what a research question looks like. Once we have the research question, once we make the research question, we subject it to finer analysis. And this is something that I perform one-to-one with the participants of the workshops that I conduct. Finer is an acronym, is actually an abbreviation for F, which means feasible, I, which means interesting, N, which means novel, E, which means ethical, and R, which means relevant. So, how feasible is my question? If I'm sitting here thinking about a question in, I don't know, Zimbabwe, or thinking about a question in Timbuktu or Bali while I'm sitting here, obviously the question is not feasible for me because I'm physically not there. I am not looking at the area where I am raising the question. So it is logistically not possible for me to answer that question. Then the question has to have an interest value. To ask a question that has been asked 10 times in the past and already answered has no interest value to the scientific community. Questions that spark interest, which is a prominent issue, maybe an issue without a solution, a disease that is not previously studied. Then is it novel? Is it new? When I answer my research question, will I be able to fill in the gap in current knowledge? For that, we do the gap identification exercise that we do in our workshops, how to identify gaps in knowledge so that the research question is such that it has value in addressing an area where the body of scientific knowledge is weak and where answers are needed. Then is the question ethical? I am, my question, or when I do my research, I will not be harming anybody. I will not be violating patient confidentiality. I will not be asking any unethical questions. And the answer to my research question is not something that will be harmful, that may harm an industry, may harm a concept. So it's the ethical part of the question that needs to be addressed. Also, wherever I'm doing my research or where I'm proposing to do my research, do I have the permission of that organization? Do I have the permission of those patients? So all, patient consent, patient confidentiality, all of these issues are covered under the ethics part. And then how relevant is my research? How will my research affect the current practice? How will my research affect policy? And even how will my research affect the future research questions that will be asked about this issue? Is the relevance of my research question. So now, briefly, before, this was the body of the session today. This is what we do in our workshops. This is how we share the knowledge, and this is how we bring the participants to making a research question of their own. Once a research question is made, then we need to find the most appropriate research design to answer the research question. And I have given a division for you here. I have given a classification of uh, research types which are used to answer research questions. At the base of it are case reports. The first thing something that sparks our interest is a case report. We see a case, it is unusual, we see a side effect of a drug, we see something that we did not know before, and we report it in the literature. After that, after the case reports come actually case series. It says cross-sectional survey, but 7 or more case reports will make a case series. That means that the disease is now, you have seen maybe 7 cases of the same thing and you are reporting it. Then are the cross-sectional surveys, which are done at one point in time. And then case control studies, which means that although it is done at one point in time, but you are comparing two groups. And you are comparing a case group with a control group. Then are the cohorts, which is either a retrospective cohort that is done from existing medical records or a prospective cohort where patients are enrolled In a research according to certain criteria, inclusion criteria, some are excluded based on exclusion criteria, and those patients are followed forward in time to give a prospective study, a quasi experimental study, which is basically a non random assignment of patients to receive either a treatment or a placebo. And quasi experimental studies actually form the parents of the modern day randomized controlled trials. Now, one misconception that I want to remove here is that you cannot become, if you decide to become a researcher and you suddenly become a researcher who's doing randomized controlled trials to begin with, that just doesn't work. If you want to do an RCT or a randomized controlled trial on a subject, you have to have a case report, case series, some cross sectional studies. You have to have evidence in existence before you go on to do studies at the level of RCTs and meta analyses and systemic reviews. Many people are under this impression that since RCTs are so, they're so charming and they're so stylish and they're so modern, we should begin by doing a randomized control trial. That just doesn't work that way. In order to become an authority, and all of us should do research to become authorities in our areas. If we want to become an authority in our subject, we have to start at a low level of maybe a case series of a cross sectional study and slowly take that up to the level of a randomized controlled trial. That way, when somebody is searching our name or somebody is searching that subject, for example, pediatric fever, just like I said, fever in a child. The first name that pops up in Google is Afshan Khatak from, my country, or such and such from Egypt, or such and such from UAE. So, to become an authority in that subject, you need to have a full command of the area, of the research topic, research area, before you go on to do RCTs and meta analyses in that area. This is a concept that people just, they don't realize that, oh, okay, so this is the first thing that we have to, this is the first step that we have to do is to go for cross sectional surveys and case series before we go to higher levels of evidence and higher levels of research design. So this is a very common confusion of case control versus cohort studies. Case control basically are happening at the same time, and cohorts are either moving forward or backward in time. So all I have to say, I have the link here in the presentation. You can go and check it out yourself. But this is, occurrence of exposure. Has the exposure already occurred or are you waiting for it to occur? Then which direction in time are you moving? Are you moving forward? Are you moving backward? Then is the occurrence of outcome. Has the outcome already occurred? And then minimizing bias. In order to, if you're moving backward in time, then it's very easy to get biased. And addressing bias is a completely separate area in research that can be discussed in detail. But for the purposes of this session, all I can do is let you know that we have to minimize many different type of biases that can enter into our research design. So in the next session, I'm going to be talking about, how to address your research question. So if you have a research question, go ahead and note it down. If you don't, give yourself the homework to make a research question. Because, why am I stressing so much on the research question? Because your title of the entire research, the design, the title, even the objectives will come out of your research question. So this is that step number one that will put you on the path to doing scientific research. Okay, so here is something that we will be doing in session 4 of this series. But this is, I want to give you an idea that after attending these 4 sessions, you will be able to write a full-fledged introduction for your first research project. I always share this in advance, because if the participants don't know where we are going and what is the direction that the workshop is following, it really doesn't help. So to leave a workshop with a fully referenced introduction, which is ready for publication as soon as the results are compiled, is a very, very big motivator. And an introduction can only be written after you have selected references for your project. And I do a live demonstration of this in my workshops. I can do it for you in one of the sessions as well. But this is, you'll be surprised that writing the introduction came first and selecting references came later. And this is one of the very, very effective and very useful tricks that I share in my workshops, that you don't need to have all the references before you write the introduction to your research. Basically, the research is, the modern design is the V-shaped design, and it is to describe, why is this research important is how you start. For example, again, as I said, fever in a child, so I can write that infections are a leading cause of morbidity and mortality in children. So why people would care about this topic. Then what is already known about this topic? Then, what is not known about this topic? So the gap, like I said, to identify a gap it's an exercise that we do in our workshops. Once the gap is identified, then you have your background. What you already know, what are the existing gaps in this knowledge, and then why is it important to learn this new information? So once you have identified a gap, it is very easy to explain why this research is important. What are we going to learn from this research that we do not know already, and how is it going to help us? You have a full-fledged background written there. And then following that, in the end, you state your own aim, and you say that, as our research team, we propose, or we want to proceed it to answering this question, because this and this and this is what we will achieve through this research. So that is a writing exercise, and I said that we always do that in our workshops. And I can show you a live writing exercise like I did in the session 4 of the Research 101 that I've already shared on my channel. But I will be doing that for an international audience, because that was done for Pakistani students. And I will be doing a live demonstration for international audiences. Then writing a review. And basically, writing a review was your homework, writing a review of this session, and also to write your research question. And then let us hope to get back together in the next session. I think I've already made it clear what the aims and objectives of the series are, and we have to go through all the 4 sessions in order to get at least an introduction of how to do or how to start doing medical research. So I thank you for your participation and your patience, and I hope to see you in the next session. I'm going to stop the screen sharing now, and I'm going to shortly stop the recording. Your questions are most welcome. If you have any, you can write to me. I will give a link to my email address. I think it's already linked. And I do hope to see you in the next session. Take care, and Allah Hafiz. I will stop the recording now.